Then coming to the tumors in liver and biliary system, first will be cholangiocarcinoma. Cholangio means bile duct. So carcinoma in the bile duct is called as cholangiocarcinoma. It can either be intrahepatic carcinoma or an extrahepatic carcinoma. And extrahepatic is going to be much more common, especially in the perihilar region, wherein it is going to be given a special name called as Klatskin tumor. So Klatskin tumor is the tumor or cholangiocarcinoma occurring in a extrahepatic perihilar location, which is at the junction of both the right and left hepatic ducts. Okay. So what are the risk factors associated with cholangiocarcinoma? We have certain parasitic infections like Opisthorchis sinensis, Clonorchis sinensis, and also some cystic diseases of the bile duct like choledochal cyst and Kerales disease. Kerales disease is also choledochal cyst, which is involving the intrahepatic bile duct. And then you'll have choledocholithiasis, so stones in the common bile duct. Then primary sclerosing cholangitis and polycystic liver disease also. So these risk factors can be asked. Next we'll see about liver tumors. So the most common liver tumors in general are going to be again metastasis, and the most common site from where metastasis comes is from the colon. Okay. So the most common primary benign tumor will be a hemangioma, again a cavernous hemangioma. While the most common primary malignant tumor of a liver will be hepatocellular carcinoma, obviously, but in a child it is going to be hepatoblastoma. And most common primary sarcoma, if they ask, that is going to be angiosarcoma of the liver. And here this can be asked in MCQ. The common risk factors associated with angiosarcoma of liver will be exposure to thorotrast, which is an IV drug, actually, not a drug, actually a radioactive drug. So then we'll have vinyl chloride and arsenic. So arsenic can also lead to skin cancer. So remember, all these three bad substances are going to be associated with angiosarcoma. V for vinyl chloride, A for arsenic, and T for thorotrast. So hepatocellular carcinoma, what are the risk factors? So all of the diseases which we had seen under cirrhosis are going to lead to hepatocellular carcinoma. So starting from viral hepatitis, alcoholic liver disease, non-alcoholic fatty liver disease, then metabolic diseases like hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, primary biliary cirrhosis, primary biliary cholangitis, primary sclerosing cholangitis, then some other hepatocellular adenomas. So hepatocellular adenoma, some types of hepatocellular adenoma can become a preneoplastic condition and turn to hepatocellular carcinoma. Apart from that, there is aflatoxins which are going to be produced by a fungus called as aspergillus. So aspergillus flavus is going to produce this aflatoxin, which is associated with hepatocellular carcinoma. So in hepatocellular carcinoma, it is usually has a male predilection. So around 40 years of age group, males will be affected, and here the alpha fetoprotein levels will be elevated. So alpha fetoprotein, where else did we see it is elevated? It can also be elevated in hepatoblastoma, which is the most common primary malignant tumor in a child in a liver, and also in yolk sac tumors. So both all these three conditions you can have elevated AFP levels. So in liver will usually undergo, even though it is a carcinoma, it is going to undergo hematogenous spread. Okay. So being a carcinoma, it is going to have a hematogenous spread like that of a renal cell carcinoma. Okay. Then the mutations associated with hepatocellular carcinoma will be beta-catenin mutations, STIR promoter, and T53 mutations. So here we will have to remember about this elevated AFP levels, then the various risk factors associated with hepatocellular carcinoma. Then there is a variant of hepatocellular carcinoma called as fibrolamellar variant. Why is it important? Because it is going to be having opposite features of a hepatocellular carcinoma. So starting with, it is going to present in a younger age group as compared to a hepatocellular carcinoma. So lesser than 40 years it is going to present with, and here there is no gender predilection. So both male and females can be affected equally, and it is not going to be associated with cirrhosis or hepatitis. Okay, and the AFP levels here will be normal. So how do you define? On immunohistochemistry, if you use neurotensin will be positive, and here it is going to have a lymphatic spread rather than a hematogenous spread as in a hepatocellular carcinoma. And then this is going to have a good prognosis. So its pathogenesis is also different. It is going to have a fusion involving the protein kinase. So DNA JB1 along with the protein kinase fusion is going to be present in fibrolamellar carcinoma. So since it is kind of exactly opposite to that of hepatocellular carcinoma, it is more prone for being asked in MCQs. So Grossly, a fibrolamellar variant of hepatocellular carcinoma is going to appear well circumscribed along with a central stellate scar. So the scars here, if you see, it is having a stellate kind of architecture. So star-shaped scar will be present in the center. So central stellate scar can also be present in a non-neoplastic condition called as focal nodular hyperplasia, which is going to be associated with oral contraceptive pill usage. That is a non-neoplastic condition. Okay, so that will also have this central stellate scar. So in kidney also, you can have a central stellate scar in one of the tumors, which is oncocytoma. Okay, so here in fibrolamellar variant of HCC, again you get a central stellate scar, which is kind of virtually diagnostic for this variant. And then on microscopy, if you see, you are going to have this trabeculae of oncocytic cells. So oncocytic cells are nothing but large cells which are having a very dark eosinophilic granular cytoplasm. These are actually filled up with mitochondria. So these cells are called as oncocytic cells. So oncocytic cells will be there, which are going to be separated by these parallel bundles of collagen in between. So fibrolamellar, right? So lamellar in the sense in a parallel arrangement. Fibro means fibrosis there. So collagen is going to be arranged in a parallel fashion in this hepatocellular carcinoma.